I would like the session to be renamed as a Show Me the Money. Show Me the Money. Okay. So, a pretty interesting panel it's going to be, because end of the day, to scale up, I need money. Okay. But money doesn't come that easily. So, with this, Dr. Madhu, okay, on your own words, if you can help us to understand that who you are, what you do, okay, very precisely, that would be good, because we all know from your LinkedIn profile. Okay, so
let me take off then, because you're saying lesser time there. I'm Dr. Madhu Vasepalli. I'm a pediatric dentist, and doctor was just mentioning about AIG. So I head the dental in AIG. Besides that, I have a practice in road number 70. On road number 70, it's called Awesome Clinics. But the money part is what I think I've been called here for. So I'm every 10 years I try to take a break from what I'm doing, and the thing that I'm in the last, like, now 50 now, I think we should be retiring soon. So we fund startups. We've been doing that. I've been doing that with a couple of my partners. In the last 2 years, we've funded close to around 12 startups, and to the tune of around 2 crores per startup. And we try to support them, but the focus is more on, it's a very sector agnostic technology, and now we are focusing on deep tech. Again, sector agnostic. This is my new one, which is actually called the ValleyNXT Ventures. It's a SEBI registered 50 million Cat 1 VC, which is an AIF. So we fund startups in an accelerator mode, like the Y Combinator in the US. And what we try to do is, so if you have any great idea, already incubated as a company somewhere, you can come spend time with us. We'll give you money, and you give us money back. That's the story in short.
Sure. And Dr. Amit, from you.
Hello. Yeah. So, hi everyone. I am a radiation oncologist by training and at heart, and I also get bored very often. Like, every 10 years need to do something more. So I have initially practiced as a clinician more than 10 years. Then back in 2016-17, I thought something new needs to be done. Scale up my utility. How many patients? I was doing well practice-wise, corporate hospital, good practice, decent earnings, but started feeling underutilized. I felt I can do more. I have studied more than 15 years, in practice more than 10 years. What else to do? Then joined ISB, did a executive healthcare MBA. We were on first batch. Then started the company. You need to learn the language of business. That is very important. So first thing I did was learn that language. So did that course, but plan was clear. Start something where you can create value for a larger scale. More people can be helped. So then started onco.com, ran it for 7-8 years. Last year the company got acquired, and back to practice. And since I dealt with pan-India level, a lot of oncology work we did, served more than 5 lakh patients through technology. Internet is very massive in that sense that you can scale up your own utility in the society by unlimited means using internet. So that we did, and then now again back into service side would always be there as a doctor. You would never leave that. I never left it fully. In between went down very drastically when I was too busy with the digital side of things. Then now working with the care group, helping them expand the oncology vertical.
And this is question to you, Dr. Madhu. Many dental entrepreneurs hit the ceilings, and with 1 or 2 clinics, okay, that same fund of 400 square feet to 1,000 square feet. What needs to change in their mindset before they think about scale?
Well, I think, it's the intent and the desire to grow. And of course, mix and blend with it a lot of words that Dr. Amit has just mentioned. None of us are trained as businessmen, as doctors. We go through the entire curriculum, entire pedagogy of trying to be good doctors, identifying the root canals, identifying multiple stuff that we're really good at. And then you're seeing your competitors in corporate chains start up. And even in that, you see some of them fail. Some of them start, some of them don't grow. So again, you really require a lot of help. And there are a lot of sources like ISB for sure. There are other formal organizations, there are formal setups where you can get trained. So the idea is to just understand the language of business. It's not just about, I like to do that. That's the base of it, that you want to grow. If you don't want to grow, then you're contented, then you're stuck within your 200 square feet or 400 square feet. You want to grow, you have to have a desire to grow. And like all the panelists that were mentioning earlier about the scope of it, and there is a huge amount of scope. Somebody was asking me, how do you do that? I mean, it's your need. If you feel there is a need to grow, you will do it on your own. That's the whole idea. You have to have the desire first.
Just add to what Madhu said. It's important. It's very big problem for clinicians to scale, because you cannot duplicate yourself. When you do very well in practice, you have only 24 hours. Working hours would be 12 hours. If you are best in your skills, people come for you. People come for the doctor or the person who is treating them. Now, scaling that up has some limitations that you cannot do. That's where a lot of things come up in terms of collaborating, building your team. Those skills are very important. And trusting each other. Unfortunately, it's not easy for doctors to trust doctors. It's not easy for a top doctor to build or replicate himself in the form of another team member. Building that trust, and that is mutual. The other guy who is being trusted also has to honor it. So it's not easy many times, and majority of times we fail to scale is because of that biggest barrier of trying to replicate yourself. And always, that's where we need to learn collaboration, working with each other, understanding each other's strength. Without that, whosoever has scaled their business in clinical practice is based only on building a team which he or she can trust, and the team also honors that trust and stays along.
Okay. Dr. Amit, though this question is more towards a dental focus, but it's equally applicable on the medical side. India has a huge population, okay, and still we get to see the most of the dental practices are very small, okay, on a retail outlet kind of format. So what exactly is missing? Is it the capital funding is missing, or is it the vision, or is it the grooming up of a professional management? Okay, so what would be your thoughts into it?
So innovation is missing. We need to innovate in terms of the strategy or positioning yourself in the market, the kind of services you can offer. As the previous panel, how they described about Cloud9. Cloud9, before that we had Birthplace here in Hyderabad. So you have to differentiate in terms of what value segment you are identifying. It's not like there are different segments. The value segment is also important to be considered. And once you have that value segment in mind, then you identified the right location, right market segment, and match it, lock and key. It has to match. The moment that happens, India, if you are in right place, if you're serving the right people, if your service is suitable to them, and if you are at right price point, then nothing can stop you. The volume is so high that people will come, and they are coming. There are a lot of unmet needs. There are a lot of unknown needs. Dentistry is like your face. Everything starts from there. The first thing we do is feed or breathe. So this all is related here only. So start from that potential that you have. A lot of people I meet have gotten disheartened with this specialty or this practice because they are seeing from traditional point of view. Nothing is traditional now. You can, in any field, if you think traditionally alone, you cannot do anything new. You have to innovate. You have to find a niche segment, niche service segment, niche value segment. Those who are doing phenomenally well. And they will continue to do in next 100 years. bring, be it AI, whatever may come in, those who are able to identify the right market segment, right service value segment, and right price point will continue to flourish. You have to broaden your mindset and start experimenting. Take that risk. Maybe previous generation could not afford to take that risk because roti kapda makan was the primary thing. But maybe as we progress, next thing, earning alone is not the priority. Goal should be that vision to establish yourself in the market with that niche identity.
So Dr. Madhu and Dr. Amit put together a question, tried to answer it. What can dentistry can learn from the successful healthcare and wellness clinics? Like we have chains of diagnostics, we have physiotherapy, okay, we have diabetic chains. So what are the best? What we can learn from them, and which is possible to be applied in real-time dental practice?
So, to answer that, as you took the question that, what can we learn? So there are dental chains too. It's not that dental chains don't exist. There are, Clove is a big example. Clove's raised around, a couple of months ago, they had raised around 35 million at a newer valuation. And now recently they have had a higher valuation and they're raising more. So also there are, this segment is called as the DSC, dental chain networks. So they have the whole system is improving. It's not that it isn't there. It's just about, as Dr. Amit was mentioning, that you need to have the intent, you need to have the trust, and you need to want to do it first. If you don't want to do it, there's nothing. And there is enough capital in the market. There is, you just have to knock on the right doors. There are enough people who are willing to fund. And I'm a part of the AIG hospitals. You've seen that grow. There are other hospitals. I've studied models of dentistry before joining AIG. The other chains, and our thought is only about Hyderabad. We are talking of Hyderabad, but if you travel, I go to Delhi, Mumbai, there are chains that are doing extremely well. It's your intent that you want to grow. If you want to grow, the sky is the limit. There is capital, manpower is plenty now. You can see the number of colleges, and that is where we started discussing, saying that dentists coming out of dental school are no longer practicing dentistry. They're joining organizations with our CRM, CROs. We have floor managers as dentists in AIG. Very sad. Why does that happen? You cannot blame the system always. You want to do it? Yes, there are people who are doing it. So I think it should come out from the person within that I want to be different, I want to change. We call that the product market fit. You want to have that correct thing that you want to call yourself for. And then there are the go-to-market strategies, different target segments, all that is possible.
Dr. Ahmed, so when we talk about franchisee model, like let's say Starbucks, McDonald, or even a wellness centers, why they are able to scale up franchises, the people who head and deliver the services are in the pyramid in mid or lower strata. But when it comes to healthcare delivery, let's agree, the people who get into BDS or medicine, they are top strata people in the pyramid. So is that one of the reasons that franchisee models are struggling? I'm asking out of your experience because you have run a successfully Onco Cancer Center. So what's your thought about it?
Franchisee model can definitely work. Only thing is you need to create standardized processes. You need to innovate on the process side of things. So experience, customer or patient experience as a business strategy has to be seen. Okay, what kind of experience you are able to offer, that's what you can scale. You cannot replicate yourself. You cannot be in 10 franchisees as a clinician. But if you put right processes, if you put right people in right place, build right team, and standardize the process and ensure that you're controlling the user experience, that's where the magic is. The Starbucks story, what are they controlling? The process, the user experience. That's where the real magic is. So it is difficult. The most difficult part is replicating yourself. Impossible. But if you want to definitely do that, focus on the processes. Focus on the customer patient experience, monitor the outcomes, take that feedback, because if you don't do that, your franchises are going to fall, and once one or two franchises fall, your own brand falls. So process is most important part of scaling. If you can replicate if you establish right processes, establish right team, train them, and ensure the customer or the patient experience is same, as be it your own place or your franchisee, then there's no reason why you would fail. Then you have to make an attempt to fail.
So on one liner, you may agree or disagree. Then why? Example wise, suppose I was accompanying a chronic diabetic patient to a chain of diabetic center. The reason why that person left going to that center is every time he visits, a doctor is different. Okay, then we found out retention has become a problem. So that's what I meant by this industry needs a high profile people. How should we go about retaining and giving to make that successful, like Starbucks? Is that possible, or it will be always the holy grail here?
So in that, if you say that every time doctor changes, that's very bad. This is a relationship based business. Every time you visit a doctor or patient visits you, it's a relationship building. It's not transaction value. If you see it that transactional value, you need to upgrade yourself in terms of maturity to understand the very important emotional aspect involved. There is a lot of trust involved in this. No one is going to lie on your chair without that trust. And that trust happens with interaction, with multiple visits. So if every time doctor is changing, a lot of times this happens in dentistry chains. Every time the junior is different. So that breaks the bond that can happen. Every time if I have to go to a place, same place I am going, and every time doctor is different, then I have a choice to go any other chain also. So I'm not building that bond. Human relationship, the human component of that relationship will break it. You would never be successful because you have commoditized your services. So that way it should never be done. The human interaction component, the bond building that happens, and this is when you touch anyone, you are building a bond. So when you touch someone who trusts you, is a most sacred part of it. So that you should never do. Even like if I know a guy, he's my friend dentist, but if I go for scaling or something, if he sends someone else, every time someone else, he is thinking that my work or that particular work is less important for him or her. So then for me, he's creating a scenario, okay, if you don't want to come, don't come to me, you can go anywhere. Because even I don't care who is treating you, if I am not treating you. So that's where you are breaking that bond. Should never do that.
I'll be a little deviant from that, a little. Because if you want to grow and you want to increase the number of clinics, you can't be in all the places. That's the problem. Now, every time a patient comes and he wants to see me to do the scaling, may not be possible. But I want to grow. I want to have more centers. I can't be everywhere. So the concept of branding, to rely on the brand that if I go there, I get the best, again comes and stems from the fact what Dr. Amit has been mentioning about the trust. So the brand should give you a certain amount of confidence that if I go there, I'll get the best treatment. For that, it is again about the education of the patient. Education of who you are, what your values are, what is your vision for the thing. And attrition rate, it's called LTV, your lifetime value of your customer. Purane zamane mein, you would have doctors, the patients sending their children. I'm a pediatric dentist. I was like, as doctor said, being in the right time, at the right place, with the right kind of patients and all of that. I've grown to a point where I have seen people who started as a junior position in an organization. Today, they're the CEOs of top companies. And I've been lucky. Those children that I've been treating since they were 5 years are now in college. I've gone to the weddings of my patients. So but that's the kind of bond you build, for sure. I'm here sitting. My next thing, the moment my session is over, I'm going to call my front desk and ask, "Kitna paisa banaya aaj?" My clinic in Journalist Colony or the others, how much have we made? So that KPIs and KRAs are very important. So if you have to grow, you have to leave certain things. I have a very good friend who's had around 120 clinics. He cannot be everywhere, but then he's willing to take that risk. I might lose some patients along the way. That's okay. But every time a patient comes back, which is why now, the 5 words that everyone's talking about in the market called focus. First is feedback. You always have to rely on feedback. Feedback is both internal as well as external. You want to collect every time you get into an app and you're getting out, how was your session? How many ranks would you give me? How would you rate me? Then on the other hand, you're also having to have the feedback from your own team. As Dr. Saab said, you have to get your feedback. What are the patients thinking at the end of the day if you want to grow? So the second word is orientation. You have to orient your team into that concept and the groove, that the whole system from your front desk, the lady or the guy who sits on the table at the front desk, till the moment they walk out, everything is streamlined. Everybody talks the same line. Both the junior doctor, senior doctor, the junior says something, you go back and then you say, no, change the treatment, doesn't work. All of us do the same thing. So we have to be on the same thing. In completion of it, complete the work. If you look, I have a lot of friends in the US who are running chains of practice there. So their target is that they know exactly what they want to finish with that patient. Complete the whole thing. Don't leave anything for the patient to think. If you leave the patient to think, he will go somewhere else. So you have to have a definitive line of treatment. All of us communicate the same thing. And the 4th word after that is you. Urgency. In dental practice, at least, Dr. Saab, what we need to have is urgency. There are 2 kinds of dental clinics or dental practices, bread and butter, boutique. Just like the restaurants that we see. One restaurant, you take the coupon, only then he'll serve you food. There is the other, you finish it and then you pay. 80 to 90% of the practices, all of us have accounts receivable. Patient has had the treatment done, he has gone, your teeth are in his mouth, you have the lab guy coming behind your back, the patient has not given the money, and our things are building up at the back. That is because that's how we are working. The market, we have allowed it to happen. I've practiced in Chennai, a lot of colleges around, but they still have great practice. Bangalore has great practice. Calcutta has great practice. Somewhere in Hyderabad, what I feel is we are allowing the patients to dominate, which is okay because all of us are not able to strongly say that to the patient. Fine. There are few practices that I have been consultants with. They will, as Dr. Saab said, some will do exceptionally well. Some will not. The last word is on systems. In the word focus, the last word is systems, wherein you have systems in place. So even if you're not there, they expect it. So the communication channel is so well from your front desk that, okay, you're going to have a crown today. There will be a specialist. Dr. Madhu is not going to do the crown, is fear again. There is a specialist who will attend to you. So the communication. So that systems has to be important. And the last one, not a part of focus, is the P, which is patience. You have to have patience to grow. And to any business, you have to have patience. And along that way, in the patience is where you are trying to reiterate, pivot your thing, change your plans, change the path. Different strokes for different folks.
So Dr. Madhu, you have invested multiple ventures. Okay. What are the key qualities or signals do you look for in a business or the founders who are sitting before trying to invest? And what advice would you like to give to the dentists who want to scale beyond chair practice?
See, normally, so I'll give the background to that. So we run an accelerator company. So an accelerator is, after the company gets incubated in something. So my risk levels were, if we want, because obviously we started as an angel network. So I pooled around 90 to 95 CXOs from different areas in India, geographically, from friends because I've studied all over. And we would ask them, we would on one side find good startups. And then we would make these startups pitch to the investors, syndicate their money, and then invest in this company. Along the way, we work on a principle called MIB, We have mentors, we get investments, and we also get them the business from it. So dentistry as such is a specific business, but we are now focused more on the deep tech startups and all of that. And what do we focus on? We focus on the founder. It is always the jockey that is important and not the horse. You give a good man ghada, usse se bhi paisa banaye. It is always the person. It is the personal quality of an individual who is responsible for the success of the practice, success of the business, willingness to learn, willingness to be mentorable, coachable, agrees for many things. I will do like this only, and you're done. You will remain wherever you are. Ability to change, correct your course, and learn. So I've learned a lot. So apart from my, I run a not-for-profit trust for the last 10 years. My not-for-profit is more profitable than my dentistry. So I have a cancer screening bus. We raise close to around 5 crores every year on a not-for-profit. Would I do that in my root canals? Does it mean should I leave my practice? No, that is where I built my thing. That's my core. I will never, like Dr. Saab, I really admire that. In 3 years' time, I'll come back to do practice really well, as in the sense that there is no need for money anymore. So then, you've created wealth, not money. What I'm doing every day, practice, is money at the end of the day you create. But what are you creating essentially towards the end is wealth that you want to have generationally. All of us will obviously get married, we'll have children, all that will happen. So all that is important. So will dentistry help you create wealth? Yes, it will. Provided you learn to look at it as a well-oiled machine that it can give you. So it's again all the jockey, answering to that one question. The person is important.
So Dr. Amit, I know that you have compliment, but you may compliment within this itself. Dr. Amit, you have been through the real journey of building and funding healthcare startup. Okay. So what would be your guru mantra or lessons you have learned from your fundraising experience, and the things we usually don't hear it in online or in conferences?
The secrets.
Yeah, we need to know that. Why should you be only the millionaire in this floor?
There are no secrets as such. Those are hard truths. Okay. Investor means what? He is looking at you as an opportunity to multiply his or her money. Are you the right jockey, as Dr. Madhu said? But if you come with a gadha, I may not invest because I don't know you as much. But if you bring a gadha along, I may see you in a different fashion. So not to your context was different, but see, investor is very clear and it's fair. It's business for them. They're doing business. They don't commit as a CSR mentality. They say that, okay, I want to multiply. Now, is your solution or a company or the idea or innovation worth investing? This, you have to be very critical about this. Not all, if something can be done, does not mean it should be done. This I follow in my life also. Every time we think that, okay, we should solve this, we can solve this. If you can solve it, okay. But when it comes to business or life, other matters also, these are two different things. If you can do, does not always mean you should do. So when you come up with a business idea or something, you have to define that idea, especially when you are looking to get funding for it. What is an idea? Its idea is a solution to a problem that is big enough to be solved. Okay, and your solution is worth paying for by too many people. The 3 points very important. Is your problem big enough? Is it really a problem to be solved? Not every problem need to be solved. So is it such a big problem? Does it need to be solved? Will someone be willing to pay for it? Okay, and can you scale that solution? If you are the only solution, Maximum what you can do is one clinic. Franchisee, when we were talking, franchisee when I meant was, if you create also franchisee, you put in processes, but the leader of that franchisee must be working like you do, at least to an extent. So the team, the processes, the experience that you provide, you have to ensure that the franchisee is also providing. So when an investor comes, he sees these three things. Are you the right person, or do you have the right team? Alone, no one wants to invest in single founders now, because there are a lot of uncertainties involved. And when you are expecting, suppose I am a venture capitalist is looking at a 100x multiple, especially in early stage, 100 times return. So suppose they are investing 1 crore with you, they're expecting you to generate 100 crore value for them. So that scale they're expecting. So you need to generate a business worth 500 crore to be able to give them 100 crore. Now it's not difficult. There are enough examples before us. People have done that. The market has very beautiful thing. If it sees potential in you, it will throw you up like anything. You can't imagine what value you can generate. So forget that part. 500 crore, I can't even imagine. 500 crore is peanuts in VC world. Nothing. We are talking about now billions of dollar valuation and all. So don't worry about that. But when you go to a VC, you should look at building a $1 billion business. Tabhi uska 100 crore niklega. So your market should be big. There are a lot of technical factors. That's where that language of business comes in. Doctors are very technical people. And unfortunately, we are too straightforward. We are not storytellers. Other thing that we need to learn is storytelling. Building a story around your business idea. Story helps you, people connect with you. Story helps investors trust you. So that storytelling, not false storytelling, proper storytelling. It's a sales story. Basically, you're selling your idea with that potential to make my money 100 times or at least 50 times. So that kind of approach you need to have. You need to have that sales mentality. If you know about Ramayana, Hanuman had forgotten all his powers. And Kak Bhushundi ji came in and told him, "Arey, you can fly, you can do this, that." A lot of doctors these days have forgotten like Hanuman did. We are smart people. We know. We can literally see what is going to happen in future, especially in clinical side of things or practice side of things also. We are not confident. So build that confidence and be confident based on data. Numbers are most important part of our lives. I'm not talking, we don't need to do calculus for that. It's the business math. It's arithmetic, simple arithmetic. It need not be very complex math, but you should be able to do that math in your mind, and it's not difficult. Only thing is you need to have a very strong idea, 3 components if you remember what I said, and then your ability or your team's ability to scale it up. And money is plenty. People are waiting for right people to come and pitch them with a great idea, great solution, great story, which can be scaled to any level.
You would like to add on something?
Yeah, I mean, so this building itself, T-Hub. So we are partnered with T-Hub. Every once in a while, we get a lot of deep tech startups from T-Hub. So we have screened 3 dental startups, everything related to AI in radiology. So they have come with a solution where you just put their OPG, it diagnoses the entire condition and it gives you the treatment plan. Makes you a little dumb, but still it's very smart. So for a person who is busy, you will not end up missing any points that were actually evident to your eyes, that the eyes on your face and the eyes in your brain, the difference. So and then there is one company that's come to us called ValleyNXT. It is the first AI approved, FDA approved AI dental solution for the 2-dimensional. Now they're pitching for 3-dimensional and FDA. So there are a lot of startups. Then the electric, and taking off from Dr. Saab, all of us use. I'm sure most of you have traveled. If you go to the US, I think none of the dental clinics, actually the dental chair doesn't have a spittoon. It just doesn't. They don't have a spittoon. You can't. Beach mein the patient doesn't get up and spit. Nothing. And the aerotors that they use are all electric aerotors. So we don't have them in this country. If somebody says, look, I can do that, it's a great opportunity. You're having an aerotor. For us, you have to have a compressor, then lines, then all of that. A lot of dental clinics in the US, all of them use electric aerotors, run by electricity. No compressor. They don't have spittoons. You can, dental chair. The chair itself is an IoT. Now we're having, there's a chain that is optimizing the dental chair as an IoT to understand what is the level of redundancy of dental units, and then take it off. Because I have 4 units, but my money revenue is coming only from 2. Things like that. So there are a lot of solutions can happen. You can come up with great ideas. You can improvise them in your own clinic. Good things are there to there. There's plenty of money.
One last thing I would add, practical thing, don't fear rejection.
Yeah.
थोड़ा बेशरम हो जाना है.
बेशरम.
There's a saying in Hindi, जिसने की शर्म उसके फूटे करम. So in business side of things, never fear rejection. One problem with us doctors is we are very egoistic about these things.
Absolutely.
Never. We start judging the other guy. We never try to understand where they are coming from. वो बोलेंगे अरे वो उसको क्या पता है, वो क्या समझेगा मेरा. ऐसा नहीं. We should always try to understand the psyche of the investor. Money is most secular thing in the world. No other factor influences an investor's choice. So don't fear rejection. Rejection is important because you will never grow if you get success too early also. You never make it big.
Fail fast.
Rejection is not a problem, it's an opportunity to do better. Always take that feedback. Okay, maybe the other investor will not reject me if I improvise on this. Not every feedback need to be taken into account. Not every time you have to change everything.
Yeah.
You have to be smart at what you accept, what you don't, but never fear rejection. Bindas chalte jana hai.
Every morning I start up because every morning now we have a fund, so I need LPs. So Dr. Saab would understand. So I need LPs. So I have to ask money from people. A bare minimum of 1 crore is the amount. So I know there are a lot of rich dentists who are sitting there. Please reach out to me if you want to make your money more. Which is, so raising an LP for my fund is a thing. And I have done 3 things. Call people, 3 people every day. Be ready to listen no. Some will tell you come. Some will tell you have tea, let's have a beer, let's sit and have lunch, but no money. Some will tell you I'll give you money will not happen. So money is the most sacred thing. You should grow. I think all of us should learn that we should grow big. We should have many more Cloves. The country can afford to have a lot more DSOs. I think we should all do it. Why not? If it doesn't work, it doesn't matter. You try again. As simple as that.